This is vibrating traction. Now, vibrating traction was developed by Dr. Wogan, and it has a vibrating cervical roll here that vibrates at 4.5 hertz. Now, this is a low tone vibration to help travel through the ligament system of the body and really help relax the ligaments that are involved in scoliosis. Now, what's unique about our version of doing vibrating traction is that we set it up on this table. Now, this is something called the dental traction table developed by CBP. And this traction table allows us to mirror image or use different setups below the patient to have a mirror image setup while we're actually performing this vibrating traction. And when you see it, when we set people up on this, we can get some very unique setups on this table by putting on this vibration to help amplify the process. So we're going to show you some setups that we do for scoliosis patients on this table. This is a very common setup that we use on the vibrating traction, and this is normally done for a standard S-curve setup. And typically in an S-curve setup, we have some hip rotation on one side, we have some rib deformity on the other side. So what we do is we oppose those. We use some wedging here in the hip to derotate the pelvis with a weight to create some counter pressure. And then a typical S-curve that we're going to have rib deformity on the right side. So what we do is we get a roll and we stick it under there to try to bring those ribs more anterior to derotate the rib cage. And then while we're doing this is that we're tractioning and using the low tone vibration. And this helps decrease these things and help increase the flexibility of the areas to set her up for the next phase of care. This is another variation of vibrating traction. A lot of times with lumbar curves, they'll have an extended pelvis. And that pelvic extension helps promote that lumbar curve. And what we find is that the bigger the pelvic extension occurs, we see those as more associated with larger lumbar curves. So we want to decrease that. This is a very good way of decreasing that pelvic extension, is that we use a block under the sacrum to tilt the sacrum. And then we're also using a strap to pull down here on the pelvis. And we're creating that, decreasing that pelvic extension. And then at the same time, we're using the vibrating traction here to help relax the ligaments through the ligament structure of the body up here in the cervical spine. So we're creating that traction, we're decreasing pelvic extension. This is a really good setup for lumbar curves. This is another variation that we do on vibrating traction, and this is what we do for thoracic curves. A lot of times with thoracic curves, they can have a decreased thoracic kyphosis. So what we're trying to do is actually increase kyphosis in a lot of thoracic patients. So what we do is we create a well into the table, and then we're actually rounding the shoulders with some straps, and we're actually pushing down to actually increase kyphosis while we're doing this low tone vibration to help travel the vibration through the ligament system of the body. This can help improve that thoracic kyphosis, which is very difficult to improve in thoracic curves. In fact, the flatter the thoracic spine becomes in a thoracic curve, the more difficult it is to correct. So this is one of the things that we try to do.